Jay Pendleton, MedTech Voice. I'm here at the ESMIS, Society for Minimally Invasive Spine Surgery with Dr. Elizabeth Lord. Thank you so much for sitting down with us. Welcome.
Thank you.
Yeah, this is 5 Good Minutes with Dr. Elizabeth Lord, who's at UCLA. She is a board-certified orthopedic spine surgeon, treating a lot of different pathologies in Southern California. One of the things we were talking about as we were getting ready for this discussion was, how do you become who you are today? How do you become an expert in your field?
I've been on a number of traveling fellowships and had, opportunities to work with and learn from some of the, masters in the field. So it's really, that was a really formative experience, and that really progressed my lateral training. It's an investment to take the time out and do these things, step away from practice and do them. But the way that it's really changed my thinking and improved my performance and my outcomes has been invaluable. So to any younger surgeons who are looking to kind of take what they've learned in residency and fellowship and move their practice forward, I'd really recommend getting out there, seeing how other people do it after you've had a couple reps under your belt.
That's fascinating because you could get caught, I would imagine, not being a doctor, but just thinking about anything that you're trying to be excellent in, and you get caught in your own world where I've worked with doctors for a long period of time. You like things a certain way, typically, not you.
Yep, I do.
Exactly. It's the same way every time. I want the same team, the same stuff on the Mayo stand. But then getting yourself into, I wouldn't say a discomfort zone, but just a place that may approach things differently. I mean, you attend a group, the old adage is you 10 spine surgeons in a room looking at the same pathology. You're going to get 20 different ways to treat it.
Yeah. Picking the right case for the right person. So also somebody who doesn't do just one thing, who has sort of a variety of options to choose from, and can articulate to you exactly why they're choosing this surgery for you, and go through potentially why they're not choosing some other way.
That's right.
I also recommend people get second opinions, third opinions. I mean, there's 200 spine surgeons in LA to choose from.
Wow.
So, if you want to get a couple opinions, there's nothing wrong with that. And any surgeon who has a problem with you getting a second opinion or is trying to pressure you, and to sign on the dotted line in clinic, this spine surgery should not be high pressure sales. Like, you're trying to do the right thing for the right patient at the right time. And that's very much so, a discussion and a level of trust that needs to be had between the patient and the surgeon. And so if you're not finding that, go somewhere else, ask the second surgeon what they think of the first surgeon.
Right.
It's all should be pretty open.
What I feel is we have an ability now more than ever in 2024, 2025 to build digital trust, scalable, where you can be up on a podium or be in front of a camera and sharing all the things that you've learned, the aforementioned excellence that you pursue every single day. How do you market yourself today? Can you build this trust, as you mentioned, which is so important to your patients, but how do they find you?
I do find that patient word of mouth referrals go a long way. I do a lot of tumor, so that often comes from, not totally elective, but that comes from oncologists and the oncologists seeing the work that I've done with their other patients. So I just try to do the good work and kind of make it visible in the spine society, and hope that gets me where I need to go. But I don't know, maybe in this day and age, it's not enough. There's certainly others who do it better.
I'd love to give you the floor to share whatever you'd like. I thought it was very moving to see a lot of people in the industry coming together and really addressing something that needs to be addressed. So Dr. Lord, please, I'd love to maybe whatever you'd like to share there.
What I'm most excited about is this idea of taking, all of these tools that we have, endoscopy, prone lateral, sacroiliac joint fusion, AI rods, custom patient-specific rods, and really combining those. Like, there's so many different techniques. So taking all of those different techniques and figuring out what is the most minimally invasive way to accomplish the goals of surgery. So there's a lot of big ways that I've learned, osteotomies and bone cuts and a lot of, stuff that you can do, kind of take the spine apart and put it back together. But how can we accomplish those same alignment goals and give the patient pain relief by maybe doing it less invasively and really minimizing that tissue damage and getting them back to life quicker.
Wonderful. Dr. Elizabeth Lord, UCLA, orthopedic spine surgeon, and trailblazing the women in spine movement. Thanks for sitting down with us on MTV.
Thanks for having me.
Yeah, good to see you.